We can't fix the world alone, but collaborating isn't easy, and systems are allergic to change. So how do we do it without losing our damn minds?
That's what we're here to find out.
I'm English Sall.
I'm Jeff Walker. Welcome to System Catalyst, the podcast that cracks the code for making the world a better place.
Hey, Jeff.
Hey, English. How are you?
I'm doing good. You sound a lot better than last time we spoke. How are you feeling?
I'm better for sure, but still got a little bit of hoarse voice. I had the flu, and my whole family did, and my grandkids, did. It seems like it's everywhere.
Definitely. I was just talking to someone just about how much school my kids have missed just because they've been sick or we've been sick, or I think they've been to school collectively a whole maybe 1 week in January because everybody's been sick.
Yeah, it makes me really appreciate our health system where you can just go to the drugstore and get some Tamiflu from the doctor. You and I, in our experience in Africa, this healthcare there is harder to access. And I can't imagine it for refugees. I think it's the subject of your interview today, right?
Yeah, I'm really, really excited about this interview today. I was able to interview Senan Ebrahim, the co-founder of Hikma Health and the CEO of Delphina. And he is a really wonderful guy. And as you know, I'm a data nerd and he's a data nerd. So we really got to talking a lot in this episode about data and access to data and how we can better use data to really enable better healthcare for people.
Well, in particular refugees, right? There's 75 million of them out there and growing dramatically, sadly. And they stay in these camps for over 20 years on average. So you got to have a health system to support it. So great he's building that organization to do that. Tell me more about how he does that.
Yeah, he really walks us through the process in this episode and, talks a lot about not just building the technology and really trying to enable better access to care and higher quality care. But he also talks about a really inspiring and heart-wrenching trip to a refugee camp in Lebanon and everything that he learned there. And I think one of the main things that I, pulled out of that interview is that the data is so important, and having high quality and just really robust data infrastructure. But also it's about pulling out the story from the data and the humanity that exists within the numbers and within the technology and ultimately what it is we're trying to achieve with providing healthcare.
That's great. And I know one of the other points I heard about him is that he spent a number of months looking at the system, actually interviewing people before he actually created the app and created his answer, which I think is an important learning point for us to really listen better to what the problem is before we jump to the solution. And it sounds like he really went through that. So I can't wait to hear about it.
Yeah, it's a really good one. Here's my interview with Senan Ebrahim. So, Senan, you're a physician, you're a data scientist, you're an entrepreneur, you're a dad, you like so many other things. What made you want to pursue these areas? And B, tell us about how Hikma Health kind of evolved in that pursuit of wearing all of those different hats.
Yeah, I'm really grateful that I got to work and continuing to work at the intersection of a lot of really dynamic fields. And I'm grateful that I was just born in a certain place and time, right? As a physician now, there are all of these opportunities to engage deeply with software-based technology as a lever for change in a way that, frankly, wasn't even possible 20 years ago. When I first started out my career thinking I'm going to be, a practicing physician, I didn't realize the extent to which these technologies would transform my ability to make change. And Hikma Health had a very, very special role in my life and my arc as a physician and scientist, where I realized we can actually democratize a lot of what's currently already being done here in the United States and elsewhere in other high-income nations, and bring it for the first time to people who need it most, whether that's in refugee camps in Lebanon or, migrant serving clinics in Nicaragua, or, the refugee camps in, Cox's Bazar in Bangladesh. We have a real opportunity here to bring the technology home to where it can make the most impact. And that, bent the arc of my entire career, where I ended up actually not practicing clinical medicine, which had actually been my decades long intention, and forging a career at the intersection of healthcare and technology. And as I think about the future, you alluded to the fact that, you and I are both parents, very grateful for my little one who's just rounded at the 1 year mark, and thinking about what the world will look like for him and what the world that we now have a responsibility to create for our children, making sure they have, access to healthcare, access to responsible technology, particularly with, the AI wave that we're seeing going on right now. And as you and I have discussed more recently, the kind of habitable environment that will enable all of that health to come to pass. So really grateful to now be, entering this phase of my career where I'm able to make an impact at the scale of now, with Hikma Health, hundreds of thousands of patients, and aspiring to impact millions of patients with the technology that we're creating.
Senan is combining his medical and data experience to help alleviate the health crisis in refugee camps across the world. When asked why this issue in particular, he often refers back to a story about a refugee called Hisham.
He was an 8-year-old Syrian boy. He's now in his teens, and he moved from Syria to Jordan around 2015-16, middle of the Syrian civil war. Turns out he had type 1 diabetes. Nobody actually realized that when he was living in the camp in Jordan, and he kept presenting with these systemic symptoms like fever and just a runny nose and like just feeling lethargic. And so his family had no way of really knowing. And his providers, when he would show up to the camp clinic, would say, "Oh, I think you've got a bit of a head cold. Just, go home. You'll be fine." That happened multiple times before he developed a much more severe crisis, a diabetic ketoacidotic crisis, which is a life-threatening complication of diabetes. And eventually, he presented to a Jordanian hospital where thankfully they reversed it and he ended up being okay. But his story has been shared very publicly on the front page of the New York Times, an article from about 5-6 years ago. And that was when we realized that is who we have to solve for. We have to be able to, if we're going to give any level of insight, whether that's simple data as a picture, a summary data panel, which is what we provide right now, or some kind of AI/ML based analytics, it all has to just work for that first clinician. Let's say it was a member of the nursing staff who saw him in the camp clinic and triaged him so that she would triage him correctly. It has to work for the physician who should have seen him and the physician who did see him in the emergency department. They should all be looking at the same story that should have pointed to the possibility that this young man has type 1 diabetes.
That's a really powerful story. To make sure this kind of oversight never happened again, Senan and his brother Hassan created an app that functions as a simple electronic health record, commonly known as an EHR. Basically, it stores a refugee's medical information that a doctor can then reference to provide the right care.
So what we built is basically, this is our Hikma Health 1.0 system that's live. It's free and open source on our GitHub. Anybody, anywhere can download and activate it. So what it is basically a free and open source offline first EHR that works in multiple languages with lightweight, easily customizable workflows. So it is designed to fill the gap of about 50% of clinical settings on Earth today that don't have access to an Epic or a Cerner, and it wouldn't be the right product to meet their need. So we wanted to create something that was versatile and flexible, easy to use, with the understanding that these clinicians are not looking to replicate the burdens that we've created on our American healthcare system with extensive documentation for billing, but they're looking to create and capture data that is clinically impactful and useful for them to refer to in the future in the care of patients who will almost certainly be repeat visitors, especially in the chronic settings that we see with the refugee crises. And then as the needs of the clinic change, they don't need to put in a change request with some corporation, a million miles away, and they wait a month for it to happen. They can drag and drop in their admin interface. Okay, now I need a COVID workflow. I like the default one from the WHO. well, I'm going to tweak it with these 3 other questions, like how much access do you have to sanitation, et cetera, which are most pertinent for my refugee camp. And I'm going to put out that 12-question workflow and collect that data on every patient that my practice sees in the next 2 months. So it was very rewarding to see that during COVID, where, our partners were able to use our lightweight interface in ways that we hadn't really even imagined, and to help potentially stave off the spread of what has been now the epidemiological challenge of our time by using some of that data.
Wow. The workflows piece is so important, because if I'm a patient and I'm coming in and my provider has, access to Hikma Health's EHR, and they have that, and that's what they're using, and they're like, okay, I've got a 33-year-old white female who has cystic fibrosis, who has X, Y, and Z. There's specific questions that provider needs to ask based on either if they're screening for COVID-19, if they're screening for malaria, if they're trying to understand my health background, if they're trying to deduce whether or not they need to put me on a certain medication. Hey, maybe I'm pregnant, and they need to figure that out, right? Because they're not going to do certain things if all of a sudden they find that piece of information out in our interaction. And so when we're talking about getting the right data at the right time to make the right decision, these workflows are so important. And we expect so much of our providers to be able to have every iota of health information and training and being up to date, all of that in their head at one time. And having a partner, having a technological advisor, coach, something right there to be able to say, if this, then that, changes the game. Because the stakes are so high here, Senan wanted the app to be as practical and effective as possible. So he and his brother Hassan visited a refugee camp in Lebanon to learn what doctors on the ground actually needed from them. The experience was eye-opening.
So this is like right around New Year's of 2020. And, we had been fortunate to work with partners throughout the region and had other visits, but that was actually a very impactful visit in particular because of, I'd say, the depth of relationship that we were able to build, in particular with one clinician who works with Endless Medical Advantage. His name is Dr. Faras El-Ghadban, and he is a personal hero of mine. He is a Syrian physician who was practicing right at the Syria-Lebanon border and was one of the last physicians that was able to be active practicing clinically as, the town was shelled through the civil war. And he, took it upon himself once he relocated with his family to Lebanon's Bekaa Valley, which is one of the poorest and most under-resourced parts of Lebanon, and where many of the refugees actually have an informal status. They don't have a UN refugee status. They don't receive the food stipend. They live in informal camps, tent shelters that are set up on agricultural land. And seeing how people live there, just seeing people struggling to provide food and fuel and shelter that those of us in the data and technology world, sometimes we take for granted, that was really eye-opening. As one clinician driving around in a van, trying to serve hundreds of patients a day, I kid you not, hundreds. We would consider 30 or 50 to be a high volume in the United States for a daily load. Him seeing 100 or 200 patients is unheard of in the United States. So seeing that level of practice and that level of commitment and engagement, even if it's only 3 or 5 minutes with each patient, truly trying to solve his, the problem with the patient in front of him with the resources that he had. The way I think of him is more like a star athlete. I'm his coach. I'm his water boy. I want to help him practice at the top of his game, right? I want to see him be able to serve as many patients as possible with as personalized and proactive care as he possibly can, because that's what he's doing 16 hours a day. And if I can help him do 10, 20% better, that could be, as we heard from his patient volume, 10 or 20 lives every single day. That deeply inspired me and taught me that the product just needs to match. It needs to fit that use case, needs to work offline, needs to work in Arabic so his staff can work with it, needs to work in a one-click setting where he can open it up very quickly, record the data that needs to be recorded to fully appreciate the data story of that patient. And then when COVID struck, 2 months later, 3 months later, that was top of mind for Hassan and I, that thinking about that camp environment where COVID was going to spread very, very rapidly. And so we put together our COVID module very quickly in about a week with clinically validated inputs from MGH and others in order to serve, Dr. Al-Ghadban and his patients and others like them. So it was just so instructive. And I would really ask any other social entrepreneurs out there that are solving the problems of our time to try to engage as much as possible. And now that, hopefully post-pandemic, we can do that again in person, really visit, spend the night, stay in their homes if they welcome you, stay in the camp, stay in places where the patients actually are, drive around with them, understand the nitty-gritty of the problem, because it will come back and be reflected in the technology in a really beautiful and empowering way.
I think you said something really important, Senan, that I want to double down on. And that is this: you and I, we have the privilege of living in this world of data and painting a picture and understanding intricacies and details and being able to capture the state of something or even hypothesize about what the future holds through data, through information. And what can happen a lot, especially, we live in the tech world, we live in the data world, we live in places where our needs are met. And there can be a disconnect between what we see on the screen and what we see in, our Excel documents or in our portals with the actual lives that are being lived and the actual people that we are getting that data and information from. And I think your point of saying, go be there, go see it, go understand, so that when you're looking at the data, you can read between, the rows and the columns, and you can actually feel and see the human life that's occurring.
I think this theme of threading the story in the data, that's really that's what we're trying to do at Hikma Health fundamentally.
As data plays a bigger role in healthcare, we have to remember not to lose sight of what really matters: the patient. At the same time, data can be a really powerful tool for finding just the right treatment. I know this from my personal experience. I'm not sure I've actually ever mentioned this to our listeners on this podcast, but so I have a disease called cystic fibrosis. And I grew up going, into the hospital system and really being a patient. And there are these tests, like when you go for a checkup and you have CF, cystic fibrosis, there's these tests that you do. One of the main ones is called a pulmonary function test. So you blow it through this kind of like pipe into this big machine. And it's like you take a deep breath and you blow it out as hard as you can, almost like you're trying to blow up a balloon with all your might. And through that test, a bunch of data comes on the screen, right? And it measures your small airways and your large airways and your flow volume loop and all of these things. And that data was so indicative for me of how the rest of my day, week, month, life was going to go, right? If those numbers weren't exactly what the doctors wanted or what we wanted, it indicated some other change in course. It indicated a different trajectory of life and of my experience. And I wonder if you, Senan, have any of your personal experiences, either as a patient, as a physician, of how that information, you saw that connection and that information between human and data.
Well, thank you so much, English, for sharing that. I think seeing it from the other side, where being in the emergency department and seeing so many patients who have conditions that are, first of all, the most frustrating thing is when we know them to be treatable. They have, CHF, congestive heart failure. And we know that if they were able to have access to healthy nutritional food that was not high salt, they wouldn't be showing up fluid overloaded, unable to breathe, right? That was always the biggest frustration to me, knowing that we live in such a wealthy country with excellent hospital, technical resources and clinical resources, but the work that needed to be done was outside. So when I would see the same patient over and over again, I spent a month in the ED, I'd see this same gentleman come in 5 or 6 times for the same thing. And even more frustrating would be, and I can only imagine how the patient and their family would feel, is a patient with a psychiatric diagnosis whether that's substance related or otherwise. And they keep coming into the Mass General Hospital emergency department over and over again because that's the only place they can get care, whether clinical care or social care. And, our colleague, Dr. Henry Ashworth, who is now our chief research officer at Hikma Health, I'll never forget he taught me this. I don't know if I've ever told you this before, English, but we were in the ED together and we had one of these patients. And I was sort of frustrated that, like, man, what are we even doing? What can we do? And he hands me socks and a blanket that he's been warming in the blanket warmer. And he says, give these to the patient because that's something we can always do. And so I think Henry exemplifies the best of what an individual physician can do. But we have to empower people like Henry with more than socks and a blanket. We have to make sure when the patient leaves, when she walks out that door, she's going to have the resources that she needs socially, clinically, and otherwise. And if we have that problem here in the United States, a high income nation, you can imagine what, the post-discharge profile looks like for a patient with a chronic disease in a refugee camp in Lebanon. Each one of those people has their own story, and we need to support those who are on the front lines writing it.
How easy or difficult or what barriers have you faced with funding? Just funding of Hikma Health and really funding the movement of this system change work that you guys are doing?
It has been challenging because we're on a decades-long project here, and we're in a space that usually gets instant attention after a natural disaster or the acute onset of a conflict. And then months later, people have generally forgotten about the conflict or the natural disaster. And, from a donor perspective, the money starts drying up. What we're doing is also very novel. Typically, if you look at, RFPs and grants and what they're looking for, it's not always for like building a technology system. This is starting to change increasingly now, especially post-COVID. But when we first started, we thought, we're going to set out to build an EHR, a project that has taken tens of millions of dollars for some companies, and we're going to do it with $1 million or less. And how do we do that and make sure it's the best EHR for this use case? It's totally secure. There's things that we're not going to compromise on. Then we have to go find the resourcing for it. I would just say to all the social entrepreneurs out there, plan for, making impact on the timescale of a decade, and don't, just sort of like go all out and spend all the money at once. And so after we did our first cycle of development, as English, when we first started partnering with you all, we actually had extra funding and we were thinking about how to most use this for the maximum impact. And instead of, building some additional set of features, we said, how about we start a new model, which is what we called our Year of Migrant Health. And in that initiative, we empowered clinics to directly just go for it. If the bottleneck is that you can't afford your Google Cloud costs, we'll pay it. The bottleneck is that you can't afford or find technical support, we'll help you hire a local engineer. So I think looking to the future, I'm very optimistic that especially with our expanded vision and a renewed focus on responsible AI and ML for global development, I believe we're in a position to substantially scale.
It's great to hear that despite the occasional setback, Senan remains hopeful and even excited about the future. And I think that has a lot to do with a recent development in his personal life. Tell me about one thing that's surprising you about being a dad.
I'd say what most surprised me, honestly, English, is just perspective on like what matters. And there were a lot of things that even 2 years ago, like I'm not that much older, but I feel like just a fundamentally different person. And I think, it applies to work, but also just in my personal life. If something doesn't quite go my way, like as long as my son is happy and healthy and fed and see him smile, like that's really what matters most. And I think, the bad days become less bad and the great days become even better. And in my work, I think it gave me a new sort of perspective and passion for, I'd say on a longer term timeline, particularly things like environmental issues, which now thinking more about, the global challenges that his generation is going to face, it really puts the work that we are doing together into a decades long perspective. And the importance is even higher. But the timeline, I'd say on the flip side, I think I have a little bit more patience for something that maybe will come to pass and make impact in 5 years or 10 years than I might have had beforehand.
I feel like that's true, especially with me as a parent. I think with a lot of young parents, like you kind of have this realization that time moves too fast, and yet it's okay to just be in the moment a little bit more, linger a little bit longer, having more patience with the day-to-day.
Mm-hmm.
I like that. I like that a lot. One last thing before we go. Any final message or words of wisdom, piece of advice that you want to leave our listeners?
Well, I know my headphones are covering it a little bit, but I am getting a couple grays, so I appreciate the wisdom question now. I guess being a dad will sort of expedite that process. So I would say my biggest picture word of advice to all social entrepreneurs out there, for-profit, nonprofit, doesn't really matter what exactly you're doing, but to do it by listening first. And I was given that advice actually by Josh and Isaac, whom you know well at Medic. And I consider them friends, mentors. And they told me, when I was first setting out to do this 5 or 6 years ago, Hassan and I talked to them and they said, we did a 6-month listening tour. And I think in technology, there can often be a production pressure. We're like, go build something. All right, build it and they'll come. Build it and break things and iterate quickly. Well, if you're truly trying to serve a community that you're not really part of, which is true for us as well, right? Like, yes, my grandmother was displaced by the Syrian civil war, but very privileged. We don't live in a refugee camp. So how do we understand truly the health challenges? So we actually, learning off of them, we also spent 3 to 6 months literally traveling around, listening, talking to doctors and their patients and, allied health professionals, community health workers, operational folks that I think are true heroes that are often underappreciated in this work. How do we actually make a product that truly serves you? And I think that's why we got it right is, we were able to spend the time. We're grateful for that opportunity to visit on the ground and really learn from them there. And again, that's not something that always comes naturally in technology. Certainly doesn't come naturally to me. As you can see on this podcast, I'm a big talker, but I'm grateful for the journey with Hikma Health, teaching me to listen, teaching me to empathize and understand deeply with the patient, the clinician, the operator, all the users of the technology we're creating. So I'm just hopeful that anyone else out there listening who's jumping in with both feet on creating something new and exciting that might impact the world, go for it and start by listening.
That's it for today's show. Please don't forget to subscribe to System Catalysts so you don't miss out on a new episode. Also, do us a huge favor by rating our podcast and leaving us a review. Thank you all so much for joining us, and we'll catch you all in the next episode. Before we go, we'd like to thank our producers at Human Group Media. We'd also like to thank our incredible network of partners who are supporting our mission: the Sall Foundation, the Aspen Institute's Global Leadership Network, Echoing Green, DRK Foundation, Maverick Collective, Virgin Unite, Charlize Theron Africa Outreach Project, Boldly Go Philanthropy, Synergos, Forward Global, Nexus, and New Profit. If you are interested in becoming a System Catalyst and would like to learn more about our partners, please visit systemcatalysts.com.